the NHC, Inspector Guo Yanhong from the Medical Administration and Hospital Management Department of National Health Commission, Director Wu Hao from the Fangzhuang Community of Fengtai District of Beijing, Director Wang Guiqiang from the Infectious Disease Department of the First Hospital affiliated to Peking University, and they will take questions on the management of discharged patients, their rehabilitation, and community prevention and control. Some updates on the pandemic in the 24 hours of April the 20th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. New confirmed cases 11, including 4 imported cases. There were 2 in Jilin, 2 in Heilongjiang province. The 7 were domestic cases, 6 in Heilongjiang province and 1 in Guangdong province. There was no new death. New suspected cases 3, including 2 imported suspected cases and 1 domestic suspected case in Heilongjiang province. On the day, newly cured and discharged from hospitals 39. Close contacts that were removed from medical observation numbered 882. Severe cases was increased by 1. For imported cases, remaining confirmed imported cases 811, including 44 severe cases. Remaining suspected cases 32. Cumulatively confirmed imported cases 1,587. Cumulatively cured and discharged from hospitals 776. There was no new death among imported cases. As of 24 o'clock, April the 20th, according to reports from provinces, cities, and Xinjiang Production Construction Corp., remaining confirmed cases 1,003, including 82 severe cases. Cumulatively cured and discharged from hospitals 77,123. Cumulative deaths 4,632. Cumulatively reported confirmed cases 82,758. Remaining suspected cases 37. Cumulatively traced close contacts numbered 726,797. Close contacts that remained under medical observation 8,791. In Hubei province, on the day there was no new confirmed case, no new or existing suspected cases, no new death, newly cured and discharged from hospitals 3. Remaining confirmed cases in the province 102, including 19 severe cases. All were Wuhan cases. Cumulatively cured and discharged from hospitals 63,514, including 46,362 in Wuhan. Cumulative deaths 4,512 in the province, including 3,869 deaths in Wuhan. Cumulatively confirmed cases 68,128, including 50,333 in Wuhan. According to the reports from provinces, cities, and Xinjiang Production Construction Corp., new asymptomatic infections 37, including 2 imported asymptomatic infections. On the day, 3 were confirmed, and on the day, 32 were removed from medical observation, including 6 imported asymptomatic infections, and asymptomatic infections that remain under medical observation numbered 992, including 180 imported asymptomatic infections from Hong Kong, Macau, and Taiwan. Cumulatively reported confirmed cases 1,492, including 1,025 in the Hong Kong SAR, 45 cases in the Macau SAR, and 422 in the Taiwan region. On April the 20th, imported cases and the new domestic confirmed cases have been under 10 for 3 consecutive days, but still we are faced with the new reports of cluster cases. Severe cases in Hubei for the first time were reduced to below 20. But in other provinces, in the past week, there has been some fluctuation and upward trend of the severe cases. We should keep unrelenting focus on the routine prevention and control efforts, pool resources, and pursue at our best to treat each and every patient. Now we will take questions from the floor. Please ask questions around today's topic. Please identify yourself before you ask questions. Journalist from the first row on the right side, please. Thank you. With CNS, Premier Li Keqiang put forward specific requirements that the revisits of the discharged patients must be ensured. Across the world, there are discharged and treated patients who have been tested positive for a second time. So what has been our protocol? What is the purpose and target of our protocol? What is the significance of such efforts in managing the discharged patients? Inspector Guo Yanhong is taking the question. Thank you for your question. The national prevention and control is towards the positive. Great achievements have been achieved in the treatment of the patients. There are more and more discharged patients. As moderator, Department Director General Mi has mentioned, our cure rate is now over 94%, when we have more than 70,000 strong patients that have been discharged from hospitals. COVID-19 is an emerging virus which has led to an emerging infectious disease which is mostly unknown to us compared with what is known to us. The pathogenesis and the outcome of the disease need to be better understood. As we explore further, we need to have a full cycle management of the patients. On one hand, we should promote the full rehabilitation of the patients. On the other hand, this full cycle management is conducive to the prevention and control. The Joint Task Force has issued a work plan on the management of discharged patients, which has refined and detailed management over the discharged patients, including the quarantine, health monitoring, and the rehabilitation management. The main purpose of this work plan is to enhance full cycle management of the patients, which is conducive to the physical and psychological recovery of the patients. It involves different health institutions. The designated hospitals need to prepare a 2 to 4 weeks revisit plan. Health guidance, room ventilation guidance, and personal health monitoring guidance will be distributed to the patients after patients arrive in communities. Some localities have a home stay quarantine. Some localities have the mass quarantine. Rehabilitation notices have also been provided to patients 2 to 4 weeks. Within 2 to 4 weeks after the discharging, they have to revisit the hospitals with milder symptoms. The community health institutions can provide guidance. If patients need services from specialized rehabilitation agencies, then such agencies will be involved as well. The full cycle management needs the collaboration among designated hospitals, health institutions, and communities, and the communities. Seamless connection is needed. Family members of the patients should also cooperate so as to ensure the physical and psychological recovery of patients.
Thank you. On the right, on the third row, the first reporter, please. Thank you. With CCTV, the vaccine has become a hot topic. In terms of the vaccination, any latest progress in China? Now we will have Madam Wang to take the question. Thank you for your question. Vaccination is the most economic and efficient approach against infectious diseases. In the context of the pandemic spread, I'm sure people get a better understanding of vaccination. Vaccines can prevent the spread of infectious diseases and protect people's health. People get now more understanding about the effectiveness of vaccination and vaccines. In recent years, the Chinese government has expanded the EPI. Now, Chinese children enjoy 15 vaccinations free of charge against 15 infectious diseases. And in the year 2019, our vaccination rate has been kept above 90%. With this high vaccination rate, actually we are supported by a sound system. We have already established the 4-level vaccination program and network, and also the vaccination service covering 3 levels. All of the provinces and the municipalities in China have already had their vaccination information system well connected with the central government. And the vaccination or vaccine information system has also been well connected to the logistics information network. This has played a conducive role to the vaccination work in China. Over the past years, with vaccination, we have eliminated polio, and we are no longer the major country with a heavy disease burden of mumps and measles. The measles incidence in China has got the lowest historically, and this is the result of people's support and the joint action in the country. I'd like to take this opportunity to mention that April the 25th is this year's Children's Vaccination Day. The theme of this year's Vaccination Day is to build a health barrier against the infectious diseases by vaccination. I encourage people to take vaccination and protect their health. Okay, let's continue. On the left, on the second row, the second international reporter, please.
Thank you. I'm China Rep TV journalist. What kind of prevention and control measures will Chinese government take for foreigners among patients who have been discharged from the hospital to ensure that there won't be rebound of the epidemic situation? Thank you.
好，请翻译一下问题。
您好，来自中阿卫视。我的问题是，对于已经出院的患者当中的外国人，中国政府会对他们采取什么样的防控措施来防止国内的这种反弹？谢谢。
好，我们请吴浩先生来回答这个问题。
We will take DG Wu to take the question. Dr. Wu to take the question. Well, in order to prevent the spread of the pandemic, the State Council has already worked out relevant technical guidelines for the follow-up of the cases discharged from hospitals, just as Madam Guo has mentioned. Previously, I worked in Wuhan. Let me give you an example in Wuhan. Now, in Wuhan, the discharged cases will receive 14-day plus 14-day quarantines. That means they will take the 14 days quarantine right after the hospital discharge in the community-based quarantine facilities. And if everything goes smoothly, this patient or this person will go back home after the 14 days quarantine and then take the home-based 14-day quarantine. So in Wuhan, For people who are discharged from hospitals, they are integrated into the family doctor service system, and all of them are followed after they discharged from the hospitals. And also, the community healthcare centers will urge the recovered or the discharged cases to take the regular follow-up visits, and the healthcare facilities at the community level will also monitor the health status of these people. In case of any suspicious symptoms, these people will be helped to revisit the designated hospitals or healthcare facilities. Moreover, the healthcare professionals at the community level will provide health guidance to these recovered or discharged cases, and maintain their psychological and physiological health. We have adopted equal approaches for both Chinese and international nationals. Thank you, Dr. Wu. Dr. Wu worked as the team leader of the Community Prevention and Control Expert Team of the Central Guidance Team in Wuhan, and from February to March for more than 1 month. So thank you very much, Dr. Wu. Now we will take the next question. With the Hong Kong Economic Herald, for discharged cases, do they need to take the follow-up visit and the NAT test? We will have Dr. Wang to take the question. Thank you for your question. In general, we find the relapsed cases do not show symptoms. Instead, they just have the NAT test positive. And we had very, very few cases where they had the worsening symptoms. So for these relapsed, the positive relapsed cases, we sent them to the designated facilities for further observation. And even though we say that most of them do not have symptoms, we still need to observe them medically and provide appropriate treatment. For these cases, actually, in the 7th technical guideline of diagnosis and treatment, it stipulates that for these cases, or for discharged cases, they should have the 14-day home-based quarantine, and this can help to minimize the relapse and the spread of the disease. And secondly, during the homestay quarantine, the medical observation will be continued, and we suggest to take the follow-up visits to the hospitals in 2 weeks and 4 weeks' time. For these relapsed cases, we emphasize the follow-up visits and the retests, which are really important. Okay, let's continue. On the left, on the third row, the third reporter in black, please. Thank you. With Southern Metropolis News, we'd like to know what are the requirements for the homestay quarantine, and how about the family members, and how can the general public help these cases to come back to the normal societal lives?
Yes. Inspector Guo Yanhong is taking the question. After the patients have been discharged from hospitals, there will be an array of follow-up management measures, including quarantine, health monitoring, the follow-up visits, revisits to hospitals, and rehabilitation management. While the discharged patients are under quarantine and observation, patients should live in separate room, which is well ventilated. They should pay attention to hand hygiene, avoid social gathering. Their family members, while looking after the patients, should wear masks. Patients should wear masks as well. The discharged patient should also have a good nutrition in their dietary support. We should focus on 3 aspects. First, disease rehabilitation. Second, functional rehabilitation. And third, psychological recovery. And psychological recovery for the discharged patients may come at equal significance as the physical rehabilitation for the discharged patients. So, being it the community neighbors or family members or their relatives should provide strong psychological support to these discharged patients. As discharged patients, their bodies have already developed antibodies that can enable them to live as normal people. And there won't be onward transmission from these discharged patients. They do need more care and support from the community where they live in. We also hope that the colleagues who are working in communities and the community members will welcome their returning to their normal lives. Psychological support is strongly recommended to be provided to the discharged patients. Their psychological counseling and recovery is equally important. Thank you. Next question, please. Journalist from the 4th row on the right side, please. Thank you. With Hong Kong China Review, some patients say if NAT tests show a negative result, they will be asked to leave the hospitals. But some patients have underlying diseases, and after they go to the mass quarantine, then such mass quarantine places do not have the treatment capacity. Are there any better means to deal with such situations? I'd like to ask Director Wang Guiqiang to take the question. Thank you for your question. The COVID-19 patients with underlying diseases have been taken care of by the Joint Prevention and Control Mechanism. There is a guidance note on the care provided to such patients. For patients as such, active intervention is needed, but the patients in rehabilitation stage with underlying diseases must be treated differently from the COVID-19 patients. They should be treated in different zones or places. To be more specific, the patients have been cured for the COVID-19 and they will receive the treatment for their underlying diseases. So they should be transferred to comprehensive hospitals. There should be some connection made. There should be several steps that must be arranged from the COVID-19 designated patient to other hospitals. And if patients are in very severe conditions because of their underlying diseases, then there must be a multidisciplinary team in the hospital to treat the patient on site rather than transferring them to other places. There are also COVID-19 recovered patients with underlying diseases, but the situation is not severe, and then they can get support from the family doctors or GPs at the community level. So with these above-mentioned arrangements, the patients with underlying diseases can get treated. COVID-19 For the severe and critical patients, usually they have underlying diseases, and COVID-19 might be one of the reasons that there has been some aggravation of their underlying diseases. And on the other way around, the treatment of the underlying diseases are also important for the treatment of COVID-19. Therefore, we must ensure their underlying diseases are well covered. Next question, please. Journalist from the second row on the right side. With people.cn, COVID-19 patients, in particular severe and critical patients, because they are of older ages, the lung function are usually difficult to recover. There might be fibrillation of the lung in the future. If there are sequelae effects, how should such patients be managed so as to improve the prognosis and prevent any sequelae effects? Director Wang Guiqiang is taking the question. Lung infection, in particular severe lung infection, may lead to the lung fibrillation. Lung fibrillation may also be one of the results of the disease progression. Just like when there is a trauma on the skin, we will find certain prints later. This works same true for the lung. Lung fibrillation is manifested by shortness of breath, coughing, and difficulty in breathing. Therefore, the intervention for the prevention of lung fibrillation carries great significance. The reason of lung fibrillation is usually due to chronic damage. For example, the interstitial lung diseases. Without proper intervention, there might be lung fibrillation, which may damage the lung functions and damage the normal life and work. Of course, COVID-19 is an acute infection. The disease progression is short. Therefore, the probability of causing lung fibrillation is low. In particular, for the mild cases, there won't be the lung fibrillation in most cases, but for the severe and critical cases, there might be lung fibrillation because the interstitial changes are substantial. And there is a whole lot of inflammatory factors. During the recovery, there will be supergeneration of the lung tissues. If the disease is not severe, then it can be absorbed. But if the disease is severe, then this supergeneration may lead to fibrillation. In autopsy, we may find the solid change of the lungs and the fibrillation. So we must pay special attention to prevent lung fibrillation among severe and critical patients. NHC has an array of documents for the management and prevention, including the health management of the rehabilitation patients. And all these protocols require close monitoring and follow-up visits by the patients. Rehabilitation measures are needed. TCM methods are recommended to prevent later on fibrillation. Second, close monitoring and follow-up visits are also recommended for those who have been discharged and who were previously as severe and critical cases. We should pay special attention to the possibility of lung fibrillation, which may occur in 2 to 3 months after their hospital discharge. Therefore, we need to maintain a longer term of follow-up visits and monitoring. But as Inspector Guo has rightly pointed out, as an emerging infectious disease, we still need to research more. Science and Technology Ministry is carrying out studies on the patients in rehabilitation period to look at the progression and to look for patterns which can serve as guidance to future clinical practices. Next question, please. Journalist from the fourth row on the left side. Thank you. With the China Youth Daily. My question goes to Director Wu Hao, who came back from Wuhan. In February, you went to Wuhan to guide community work. In light of your own experiences, what were the effective measures that have been adopted in Wuhan? and what has been their role in the prevention and control of COVID-19 in Wuhan? Thank you for your question. I went to Wuhan February the 6th, led by the grassroots leadership group of NHC. We've set up a panel of community prevention and control. There were 13 of us as grassroots level health experts and 13 CDC experts.
And then on February the 17th, there were another 17 disinfection experts from China CDC were added to our team. Altogether, we have been divided into 13 teams, and these teams have visited all the communities, the residence areas, the nursing homes, the old age care homes, and schools, and etc. Then by April the 19th, altogether 1,275 pieces of advice were submitted to the government for further implementation or adoption. As far as we know, that the teams have already accomplished their tasks and returned from the Wuhan trip. The teams have already offered helpful experience as follows. First, we strengthened the grid management at the community level. We have consolidated the prevention and control efforts at the community level. We have facilitated and promoted the early intervention by the communities. Starting from February the 11th, as suggested by the team and the relevant government authorities, all the residential areas in Wuhan realized the closed-loop management. And second, we have strengthened and improved the community containment measures. As you know, that COVID-19 is an emerging new virus, and our knowledge about the virus is being accumulated. That's why, in the light of the improved knowledge, we have dynamically improved the containment measures by putting more human resources into the containment. So the officials and officers at the community levels were asked to have specific accountability. By doing so, we ensured the closed-loop management is effective, and also the daily livelihoods of the residents in the communities. Thirdly, we have optimized the process and adopted information technology to realize the joint prevention and control at the community level. The local healthcare facilities, especially those at the community level and the community level household committees and etc., have been well coordinated to implement the containment measures and share information. By doing so, we have also reduced the potential spread of the COVID-19 and improved the work efficiency and performance. And fourthly, we have specified the containment measures at the community level. The community level prevention and control team is following the government's guidance or guideline concerning the prevention and control against the COVID-19. And the specific containment measures such as the body temperature monitoring, disinfection of the environment, and the outstanding problems are well addressed. Fourthly, we have strengthened the training at the community level. In the team of community level prevention and control, we have joined the experts from different disciplines and sectors. On-site training is conducted along with the problem identification. So our approach is to offer help instead of causing trouble, and also to solve the problem instead of to punish the malpractices. So we focus on problem identification and solution proposals. So these measures or these solutions have been well implemented. So trainings regarding the nosocomial infection and community disinfection have been conducted. So the specific containment measures can be conducted with people's capacity greatly improved. Thank you. Okay, thank you. Let's continue. On the left, the front row, the first reporter, please. Thank you. With China Family News. Previously affected by COVID-19, some hospitals have suspended their patient visits. So how about the current situation? We will have Madam Wang to take the question. Thank you. As early as in March, we have requested the localities to orderly recover the hospital visits. Also, China CDC has come up with a technical guideline concerning the vaccination. These measures are being implemented. As far as we know, in all the healthcare facilities, in particular the vaccination clinics, they have already returned to their normal operation. And also, many vaccination clinics have never suspended their work despite the COVID-19 pandemic. Good approaches have been promoted. For example, in some localities, the online appointment was promoted to soundly schedule the vaccination work every day. And also, appointment is made to facilitate the efficient vaccination and the safety during the vaccination process. Also, we request the clinics to ensure the safety and the cleanness of the overall environment. Also, to facilitate immunization, at the end of last year, we already made proper arrangement as follows. The first is to strictly abide by the technical guidelines. As you know, immunization is about many children, many families. So the quality of immunization is being constantly improved. And the second, we are optimizing the EPI scheduling. For example, for this year, for the vaccines like those against polio and mumps and measles, as well as rubella, we are to achieve our targets. And thirdly, we are improving the overall environment for immunization. And fourthly, we will strengthen the inspection and checks concerning the vaccination certificates.
so as to ensure each and every child can take the full cycle of all the compulsory vaccinations. We also hope the Friends of the Media can give wide coverage to the immunization program so that this network will be needed better to safeguard the health of the general public. Thank you. Next question, please. Journalist from the third row on the right side. Thank you. With CNR. Many of the neighboring countries are faced with mounting pressure of the COVID-19 spread. What are the specific measures to step up the prevention and control against the situation? Inspector Guo Yanhong is taking the question. China has a total length of 22,000 strong kilometers of land borders with adjacent countries. We have many neighboring countries with us. As the pandemic is raging in these countries, in some localities, in particular the border provinces, are faced with ever-increasing pressure of imported case prevention. The counties, cities along the land port cities are of generally insufficient capacity of public health interventions. Therefore, we have made some preemptive arrangements. 9 provinces with land port cities have been guided to make preparations. Provincial, municipal, and county-level coordination is needed and planned to support the port cities' public health intervention and preparedness. For each port city, they have an individual preparedness plan so as to enhance the prevention and control capacity of the port city or port county. Second, we have been quickly stepping up and beefing up the capacity building in these port cities. The lab testing capacity, health and diagnosis and treatment capacity, and also the infection management, infectious disease department, and ICU capacity have been beefed up in the short time to make up for the weaknesses. Based on our thorough understanding of the local communities, we've also sent prevention and control teams to support them. For example, for Suifenhe, we have sent clinical experts, prevention and control staff, and the lab testing technicians to support their efforts. We've also dispatched mobile CTDR and P3 labs to those localities to enhance Suifenhe's capacity in responding to the imported cases. And for Manchuria, we did a similar thing. We sent expert teams to Manchuria to give on-site guidance for their prevention control efforts in general. The prevention control carried out by the port cities is one of our priorities for the current time. For the port cities, we've been looking at the weaknesses in their prevention, control, diagnosis, and treatment capacities. We've convened resources to step up the port city's capacity in responding to imported cases so as to better safeguard our gate. Journalist from the first row on the left side, please. With the China Media Group New News Media, we know COVID-19 has multiple clinical symptoms. What are the symptoms that ring high alarm for a loud alarm for us? What about the treatment of the pregnant women? with COVID-19. Thank you for your question. Inspector Guo Yanhong is taking the question. According to our diagnosis and treatment protocol, there are 4 types of COVID-19: mild, moderate, severe, and critical cases. Now, among all our patients, mild cases and the moderate cases are of the bulk part, above 80% of the total. Severe and critical cases are most related to age. Most of these cases are found among the older folk and those with underlying diseases. The clinical symptoms are not very typical. We've done some statistics analysis. Fever, 80% of patients coughs. Dry cough is also a common feature. For severe cases, shortness of breath, tightness in chests, diarrhea among certain patients, fatigueness, sore muscles are also some of their symptoms. So in general, we do not see very typical symptoms among the COVID-19 cases, but during the migration from mild to severe cases, age and escalating shortness of breath are typical factors. Pregnant women and children in general are not of a big number among COVID-19 patients. We've seen 200 plus pregnant women, and the children is only 2.4% of the totally reported cases. If we look at the situation of pregnant women, most of the pregnant women infected with COVID-19 are of mild cases, and treatment efficacy has been good, in particular in Wuhan. After treatment, the pregnant women not only have COVID-19 treated, but also delivered healthy babies. If we look at the children cases, in general, children cases are of mild cases, and the number of severe and critical cases are only a few. In Wuhan, only 4% of the children cases are severe cases. Experts' analysis says that it might be because the immune system of the children haven't developed full, which may lead to a less likelihood of cytokine storm. And also, children patients, they will seek medical services the earliest, which has again proven that early treatment can promise a better outcome. Next question, please. Journalist from the 5th row on the left side, please. Thank you. With China Daily. Prevention control in China has become one of our routine efforts, and there is a mounting risk from imported cases. Community prevention and control is still an arduous task. How can we optimize community prevention control and enhance the precision and scientific base of the prevention control at community level? Director Wu Hao is taking the question. Community prevention control is an important line of defense for the prevention of domestic resurgence and imported cases. As China is gradually resuming business operation and reopening schools, we are faced with bigger risks. Many volunteers will go back to their original workplaces, and the community is faced with the understaffing issue. At this particular moment, we must ensure the precision in community prevention so as to ensure sustained routine prevention and control efforts. Experts need to conduct analysis in light of the changes and adopt differentiated prevention control measures in different risk-zoned regions. Meanwhile, with the dynamic changes, the There should be an adjustment to the original community prevention control measures, such as the sealing off of communities so as to meet the needs of work and life. We should also leverage information technology to enhance the effectiveness. We should also enhance the data sharing among multiple departments. Information technology should be combined with existing measures.
Second, we need to continue to push forward the joint prevention control and engage the general public. Also, to improve the capacity at the community level, as this can help us to overcome the shortage of personnel or staff at the community level. Also, we can be active conducting the patriotic health campaigns, improve people's healthcare literacy and the capability to protect their health. As the community-based or the community healthcare facilities, they are also suggested to make it a more close collaboration with the community committees and implement the relevant measures, in particular the 4 early measures against the pandemic. The community healthcare centers are also important outlets of public healthcare facilities. Thirdly, we need to improve the capacity and build the capacity at the community level, such as the prevention against nosocomial infection. We need to provide easy to understand and easy to implement healthcare knowledge and literacy so as to avoid the potential nosocomial infection. Due to the time constraint, we can only allow 2 questions, please. On the right, the 4th row, the lady reporter, please. Thank you. With JKB, following the relevant policy documents, the convalescent evaluation should be conducted, and based on the evaluation results, rehabilitation suggestions would be offered. So may I ask about the details and also how to ensure the psychological and physical health of the people? Okay, we will have Dr. Wang to take the question. Yes, indeed. Convalescent or the rehabilitation issue should be watched closely, just as we have mentioned. During the rehabilitation period, we should pay particular attention to the internal functions concerning organs like heart and lung. Also, for patients with severe and critical symptoms, rehabilitation is also very critical. That's why NHC is formulating relevant technical guidelines to evaluate the vital signs, such as the functioning of the heart and lungs, to standardize the vital sign monitoring. And second, we are to provide technical trainings to related healthcare professionals so that the rehabilitation can be conducted, including the application of TCM. Thirdly, for the people in rehabilitation, active medical support should be provided to ensure that they have the access to the rehabilitation facilities. Of course, for families in financial difficulty, they may be provided with financial support. As for the psychological issues, indeed it's a big problem because for critical cases, the functions of the organs are important, but for many COVID-19 severe cases, the psychological support is extremely necessary. We need to promote relevant health knowledge among the general public to avoid stigmatization, so that the patients recovered can come back to normal lives. And also we should help the patients to get over the psychological concerns, as COVID-19 is a self-limiting disease and there's no sequelae related to it. Also, we are to provide psychological counseling and support to people with relevant psychological problems. My point is we should show care to these COVID-19 patients, and also in the back to normal or work resumption efforts, we should help these people to get back to normal lives. Okay, let's continue with the last question. On the right, on the fifth row, the first reporter, please. Thank you. With the cover. Now, domestically, the situation is improving. So my question is, in terms of or based on the previous well-targeted measures, how to recover the order in the healthcare facilities. We will have Madam Guo to take the question. Thank you. Yes, it's a rigid demand among the general public to seek doctors' advice. So while ensuring the COVID-19 treatment and the prevention, we should also satisfy the medical needs of the people at different stages. NHC has worked out targeted measures to recover the normal order in the healthcare facilities. For low-risk areas, we need to accelerate such recovery efforts. Such for healthcare services like the outpatient counseling or medical services, we should recover the normal order as soon as possible. And also we can bring into play the role of the online-based healthcare services. For instance, with the internet, we can make a proper appointment to avoid the crowding in the healthcare facilities. And also, we can use the internet to provide online counseling and also the offline actual services or physical services. Also, for patients who need to travel long distance to get medical advice, now we can use the online platform to provide the online counseling. And thirdly, also a very important point, that is to have sound risk control. In recovering the order in the healthcare facilities, the fever clinics and the triage services should be constantly improved. Management should be strengthened, and also the nosocomial infection should be well controlled. For example, the zoning practices, the disinfection and quarantine practices should be improved to identify the potential risks or to prevent such risks. So nosocomial infection would be avoided. In general, we should manage the risks while providing the healthcare services. According to our survey, we can see that healthcare quality in China has been kept at a sound level, except some localities like Heilongjiang province. We found that the majority of the provinces in China have already recovered over 80% of their medical services. So as the situation is improving, we will accelerate the efforts to recover the normal order of the healthcare facilities, but at the same time, we are to control the risks well. Okay, thank you. During today's press conference, we have invited speakers to talk about the post-hospitalization services.
Tomorrow, we will focus on the collaboration of physical and taxation administration so as to promote the resumption of business of SMEs and micro businesses. We will have the taxation administration officials and CSR, the regulatories, to take questions. Thank you for your participation.